speaker tengo el honor de presentar a Alison Joslyn, que es la directora comercial de Shire para Latinoamérica. Pero además ella tiene más de 20 años de experiencia en la industria farmacéutica. Se unió a Shire en el 2014 haciendo foco en las enfermedades raras. Ella vive en San Pablo y desde San Pablo está trabajando en este sentido. Pero previamente ella trabajó con Mikel Arriola y estudió biología en Yale, recibiendo además su MBA. Ha sido responsable por Venezuela durante 6 años para Mikel Arriola desde el 2000 al 2006 y además estuvo trabajando en otras tareas globales y regionales para esa compañía. Con ustedes, Alison Joslyn.
Gracias, Cornelia, y gracias a la organización por incluyendo Shire como compañía por una oportunidad para hablar con ustedes. I'm going to speak in English because it will be a little bit easier and more clear, but hopefully everybody understands. Good morning, buenos dias. It's really a pleasure to be here with all of you to talk about rare disease and to think how we can work together as industry, as payers, as healthcare professionals, as patient advocates, with a common goal of improving the lives of patients who have rare diseases and the lives of their families. You know, if I think about my own experiences, I've learned about rare disease and how it impacts families. I've been really impacted seeing, for instance, a boy who at age 6 had been diagnosed with a rare disease and was informed to the family that he probably would not live past his 10th year, and in fact, after receiving treatment, has recently celebrated a 15th birthday. So, you know, it gives us great hope that there are possibilities to improve the lives of these patients. It's also about improving the lives of the families where, you know, parents are finding terribly devastating news about these patients and then go on to find out that there are, in fact, some avenues to be able to improve the lives of their children. So let's turn to, yes. What I want to do in the next 20 minutes is walk you briefly through a couple of things. Talk about the challenge that we see with rare diseases in general, and look more closely at the disease, the journey that the patient with a rare disease follows. And then finally talk a little bit about what we see are some of the opportunities to be able to improve the lives of these patients. So looking first at the impact of rare disease, and I imagine many of you are familiar with this, but I think it's always important to go back and think about this, that while these diseases are very rare, there are roughly 7,000 that are known at this point. Because of the number of these diseases, the impact globally is actually quite large. So there are some roughly 350 million people globally impacted by rare disease. And if we think about Latin America specifically, roughly some 45 million individuals. So while these diseases are rare, the impact on a global collective basis is really quite significant. And yet, at this point, there are only treatments available for roughly 1% of these diseases. The other thing that I think is very important to keep in mind is that these diseases affect children disproportionately. They're genetic diseases typically, some 80% of them, chronic diseases, roughly 90%, and as a result, what we see is that roughly 75% of the patients diagnosed, in fact, are children. And the sad part of this is that many of these children are not expected to live into their teenage years. If we think then more specifically about Latin America and some of the challenges we see here, we realize that while we have some really terrific centers of excellence, for instance, CIBO here in Mexico, and then the Center of Genetics and Metabolism in Colombia as just 2 examples, we don't have nearly so many of these centers as we'll find, for instance, in Europe and in the US. What that means then is that patients often have to travel very long distances to be able to receive the care that they need, the medication, the access to physicians. And for instance, I know of a family here in Mexico where there are two boys, two sons, who are both suffering from Hunter syndrome, and they have to take their sons once a week for infusions, 7 hours each way by bus. And you start to imagine what that life must be like, and it's very difficult. 7 hours by bus is not easy in any circumstance, but 7 hours by bus with kids who are having a difficult situation, doing this on a weekly basis, very, very tough for the family. We know that across the region we have national policies going into place in many of our countries, but these policies are still in their very early stages and for the most part have yet to be implemented. What that means then is that funding of these treatments tends to be challenging. It's challenging for the governments, it's challenging for the patients who suffer the diseases. And the time to access for treatment then can vary considerably. So we know of certain countries where a patient who's been diagnosed may be eligible to receive treatment as quickly as in 3 months, but we know of many, many cases where it takes closer to 9 months, perhaps 12 months, and in some cases even up to 2 years before a patient who's already been diagnosed is actually going to be able to get their therapy. So then turning to what we describe as the patient journey from the time that the disease starts or the onset of disease through the time that they're in treatment, we know that there are challenges for the patient in terms of finding a doctor, for instance. And if you think about probably for many of us in the room, the situation when we're ill is very different. We get sick, we go see our physician. The physician can normally relatively easily diagnose what the issue is. We get a prescription, we go to the pharmacy, we get our prescription, and hopefully in the relatively near term, we're feeling better. In the cases of a rare disease patient, it's a much, much more complex situation. And the challenges again are in terms of first even finding the right doctor to go to, getting the right diagnosis, and then difficulty in accessing treatment if in fact there's even a treatment available. So looking a little bit more deeply at each of these challenges, first and foremost, finding the right doctor. It seems like it should be much more simple, but again, bear in mind that often these are children who are being diagnosed. So the first physician that they're going to see is either going to be a general practitioner or a pediatrician. And of course, these are physicians who are dealing with many, many types of patients who are seeing typical or more common illnesses who don't have a lot of experience with rare disease. Rare disease is rare. And as a result, it's very difficult for them to diagnose these diseases. Additionally, the diseases often present with symptoms that are very similar to other more common illnesses. So it's very unusual that a general practitioner or a pediatrician the first time around is actually going to be able to diagnose a rare disease. Typically what will happen then is referral to a specialist. Specialists will do testing. Maybe they'll get it right, but very often they won't get it right either. And the patient comes back to the general physician, goes through another referral process, and so on and so on. Ultimately, if you look at some of the statistics, and there's not a lot of statistics available, but the best information that we're able to get suggests that patients may see as many as 8 different physicians on average before they're able to even have their condition accurately diagnosed. In terms of the average time that it takes a patient, it's close to 5 years from the time they start going to a physician to when they may see a diagnosis. That's an average. It's not at all unusual for patients to need sometimes 10 years, 12 years to be diagnosed. And of course, there are probably patients who never are accurately diagnosed. There are also many patients, and nearly half who've received at least one misdiagnosis in their journey. And then again, if we think about Latin America specifically, there are some real challenges in terms of accessing treatment. And once a patient is diagnosed, again, it can be quite a long time before they're actually able to gain access to a treatment, assuming that there is a treatment available. we struggle with different types of processes through which patients can obtain these sorts of treatment. And, you know, in many of our countries, specifically in Brazil and Colombia, we have to go often through a judicial route to sue essentially the government to be able to obtain treatment. And of course, that's a lengthy process, a cumbersome process, and one that patients aren't familiar with. So they need a lot of help, both the patients and the physicians, to work their way through such a process. And here in Mexico, for instance, within certain institutions, we also find there are age thresholds. So, you know, a patient needs to be diagnosed before they reach the age of 10 to be eligible for therapy. So we know of situations, for instance, where multiple siblings may suffer from a rare disease. One is diagnosed before the age of 10 and becomes eligible for therapy, but very sadly, you'll find a sibling who's older who gets diagnosed at the same time and is not able to receive therapy. So one of the goals that we have certainly is, as a company, as an industry, is to learn from the best practices around the world to see how can we better work together to create the policies, to create the environment in which patients are going to be receiving the therapies that they need in improving the treatment and management of their conditions. So let's think then, what are some of the opportunities, on a more positive note, that we may have to be able to move together? And you know, what's really critical in terms of progressing in the treatment of rare disease, in our view, is a real partnership. In terms of disease awareness, that's something that's really an opportunity for the industry to provide appropriate support together with patient association groups. We need to have governments providing the appropriate level of funding to continue with research, to support diagnosis, to support treatment. We need to have payers who are putting into place reliable, sustainable access systems so that patients can gain access more quickly, more consistently. And lastly, we want to have policymakers looking to put the appropriate types of policies into place that allow companies to continue to develop and commercialize products, innovative new medicines for rare diseases. And basically, you know, we really need to work together on this. It's a partnership that's going to be critical that allows us to move forward. And one that involves, as I said, governments, experts in the disease and the disease management, healthcare providers, industry, patient association groups. And in working together, I think we can create an environment of trust and transparency that will really give us the best opportunity for making progress in the treatment and management of rare diseases. And I think we have here in Mexico one example of a very nice collaboration that, again, I think gives us some hope for improving the treatment of certain conditions right here in Mexico. And in this case, the collaboration was with